It is day 2 at TCT 2014 here in Washington, D.C., and I'm Peter Block for On the Scene. Chronic total occlusion issues have now raised their ugly head, and they are always difficult to deal with because chronic total occlusions are not easy. And with me is Dr. Jang from Korea, who has just finished talking about a study about whether to use Ivus or not in CTO treatment. So, Dr. Jang, tell me about your study.
This study is a randomized trial to showing that a lot of Ivus in the CTO intervention. We randomized the patient after wire crossing. You know that the lot of Ivus in wire crossing in CTO segment is very important, but that is very highly dependent on the operator's skill. So not easy to randomize. So our study is focused to the evaluation of vessel size using Ivus, as well as the stent optimization.
That's a very cute little wrinkle to make sure that the whole business of the wire crossing is taken out of the equation.
Right.
Okay, the wires across, and then you randomized Ivus versus non-Ivus?
Ivus guided versus angio guided.
And I guess the easy answer or the easy question is, what did you find?
What I found is that Ivus is helpful to reduce the MACE, cardiac death, MI, and TBR.
So that's a combined endpoint, isn't it?
Yes, completely.
Can you break that up a little bit for us?
In this study, we allowed to cross over. After crossover, the difference is getting bigger. So that means that Ivus is very, very helpful to reduce the composite endpoint.
As I remember in this study, about 35 patients actually did cross over, didn't
Yes.
they, to the Ivus side?
Yes.
For various reasons, but mostly to evaluate stents and so forth. But nevertheless, a large crossover. And then after that, tell me what the differences became.
Yeah. Before crossover, intention to protocol, intention to treat is the difference is getting bigger after crossover. That means that Ivus prevent the TBR as well.
So Ivus seems to be critically important not only for success but preventing target vessel revascularization in the longer run.
Right.
So if you're doing a CTO, I guess what are you going to use? Are you going to use Ivus or not?
You should use Ivus.
Thank you.
Thank you.
So there's your answer. If you're doing a CTO, it looks like clearly Ivus is going to be helpful both in crossing and in vascular revascularization later on. And if you're going to do a CTO, use Ivus.